Welcome to Inside Blood, the show where we zoom through your veins faster than an espresso injection. I'm Dr. Rob Cornney, think hormone mechanic, and today we're spilling the red tea on testosterone replacement therapy. Here's a quick fire lineup for you. Script Stampede, NHS testosterone gels for women exploded tenfold since 2015. Men, up 33%. Everyone's going at the hormone cupboard. When's your tank really empty? Well, really you're looking at under 10 millimoles and your tea is starting to snooze. Death versus doses. In folks with type 2 diabetes, untreated low testosterone, double mortality. That's up to twofold from where you want to be. Not good. Red cell hard stop, across 54%, and your blood starts to get thicker than a milkshake. Not good. Our mission, slice through the bro science, chuck in a few dad jokes and leave you smarter than when you press play. Leave you more informed than when you arrived. So, are you ready to get inside blood and decode TRT? Let's roll. Testosterone replacement therapy. So, we're replacing our natural levels or increasing your natural levels from the physiological level that you have. So as you age, these levels are going to decrease, right? We all know that as we get older, they're going to get lower and lower and lower. So then people are looking to supplement that with what's now called testosterone replacement therapy.
And it's important to make sure that we don't confuse this with what some people do, which is taking super physiological amounts of testosterone. So TRT is not what a bodybuilder does. A bodybuilder will be taking super physiological doses of testosterone and other more potent androgens. TRT, testosterone replacement therapy, is just replacing what you would normally make but are not making no longer because you're older or you're stressed or one of a dozen other reasons.
Exactly.
That's what TRT is in a nutshell.
That is. Do you want any more?
Yeah, so, well, I think the next question to ask, isn't it? That's a good thing. So, well, what do you make of the, I suppose, the current situation in the country right now, where you hear TRT, or what are your opinions on this? You hear the word TRT and it's okay. People hear the word steroids and, mums are going crazy and dads are worrying. So I think it's a bit of a stigma, right?
Well, the point is as we were just saying, it's TRT, it's replacement therapy. It's not nothing that you've probably not made at some point in your life before. So you're just doing it when you're a little older. So as we know, we'll probably hit peak testosterone levels in our 20s. We start, the testosterone starts declining after you're 30. I think loose stats are maybe you lose about 1% of testosterone per year at 30 years old afterwards. So all you're doing is you don't want to go over a certain limit in the blood, and that's why it's really important to test. Because if you go over a certain limit, you're going to hit receptor saturation where you can't use that amount of testosterone because all the receptors in your body are being used up by that testosterone.
And then what happens with the stuff that can't use it?
So, well, that just it just literally increases your side effect profile and your disease risk. So there are certain side effects with too much testosterone, and there are certain disease risks with too much testosterone, because your body's going to go, do you know what? Your hypothalamus, which is monitoring your blood all the time, is going, whoa, that's too much testosterone for me. And what it will do is it will convert it to other things such as estrogen and dihydrotestosterone, DHT, which is going to, so the estrogen's going to give you a bit of gyno, going to give you a little bit of boobies.
Gyno is, for those that might not know.
I'm not going to pronounce it. You pronounce it, Rob. Gyno.
Gynomastia.
Yeah, that's it.
But yeah, it's
gynomastia.
Yeah, exactly.
Yeah.
But yeah, I mean, like at the end of the day, TRT is a great thing, right? No doubt about it.
I love it.
You know, it's fantastic.
Fantastic.
Right? It's brilliant.
I'm on it.
It's making a lot of happy women out of there.
Not my wife.
But what we've got to bear in mind is that it's now become commonplace, a bit like chewing gum, it like used to be. So it's like, right, okay, then we've got this new invention called chewing gum, and everyone's got bad breath. So then we need to start everyone needs to start having chewing gum every day. Testosterone replacement therapy has become that exact thing. So they're not thinking about all these side effects. And also, everyone who's ever had, oh, I've got a headache, or, oh, I feel a bit tired. Oh, is that not because you didn't sleep or you didn't drink water? No, that's because I need TRT. So
the middle-age spread, I think, is something we talked about off camera, whereby a lot of a lot of guys could see that little bit of pork they're carrying is and could be linked to low testosterone.
Well, that's what we was talking about a moment ago. So it's not they've got low testosterone because they're aging necessarily. It's because their cardiometabolic health is so poor. They've got so much fat that they're not actually producing testosterone. It's actually B causing A, not A causing B, which is what we was talking about a moment ago, reverse causality. So this is where I think testing and lifestyle intervention comes in place before TRT. So if I get somebody come to us and say, oh, I want to go on testosterone replacement therapy, I'm a big proponent for TRT. I really, really am. I think it's life-changing, especially for people that use it responsibly. So I make sure that my levels never go over a certain amount. They're always between, my total testosterone is always between 25 and 30, and I'll never let it go over that, because that's when you get that receptor saturation. It's when you'll start converting it to estrogen. After 30, you start converting to estrogen and DHT, and the side effect profile and the disease risk is just too much. It's not good, and it's not good. But the first thing that you've got to do with somebody that wants to start TRT is you absolutely have to make sure that they're in a healthy position before, so you can get a true read of what their total testosterone really is. So you want to make sure that they're not pre-diabetic. You want to make sure that they've not got no issues with their prostate. You got to make sure they've got no issues with any health marker you want to try and sort out straight away. Give them lifestyle interventions, get them eating correctly, get them training appropriately. Because we one of the great things about testosterone replacement therapy is that it helps you recover. So for me, the reason I started taking TRT specifically is because it helped me recover from, because I train quite a bit nowadays. I do resistance training sessions, cardiovascular training, I do jiu-jitsu, I do a bit of boxing. So I'm always in the gym, and it helps me recover. If I didn't take the TRT, I wouldn't be able to train as optimal, because I'm training like I'm in my 20s again, but I'm now 42 actually.
But also bear in mind that Caleb does watch a lot of those things, like sleep, his food, his lifestyle. So he's not just saying, I feel tired, therefore I need TRT. It's a supplement to your existing.
Absolutely.
That's the key with anything.
Yeah.
So we've both had clients and worked with them detailedly, on a detailed basis, and we'll say, right, okay, step one, let's look at your sleep. Like, oh yeah, but what about my TRT?
Yeah. On this, I think it's interesting to dig into. Let's talk about that, because people can take for granted such basic things as sleep, which require little to no investment in the grand scheme of things, whereas a commitment to do TRT is quite a big thing.
Yeah.
What sort of reaction you seen every time you mention sleep?
Well, this is it. The reaction, because people are, there's crazy adverts out there with single markers where you can prick your finger, squeeze the hell out of it, and then put it into a little tube, send it away, and then, lo and behold, you've got a low testosterone marker value.
Or it doesn't even have to be low testosterone. It could be low reference range. So you're in within the clinical reference range, but it's just the low end.
Yeah.
And if you say to the testing company, I have low libido and I'm depressed, and you've got low reference range testosterone, they will give you a prescription for testosterone.
Yeah.
But your side effect profile, disease risk, your nutrition, your activity levels, none of that has been assessed as part of a wider lifestyle intervention.
No, even to the point at which in the US it's more symptoms based as opposed to being blood based.
I actually wanted to touch on the US, Rob, and that's because I feel that Britain is becoming more US in terms of how we are prescribing freely the testosterone replacement therapy without giving a second thought to some of the consequences that we've talked about. So we now got TRT clinics popping up. We have a TRT clinic, but the difference between our TRT clinic and all of the others is that we want to make sure that your lifestyle is adequate or optimal before we actually give you the TRT.
Yeah, exactly. And a few people aren't going to like that.
No, they're not. And if they don't like it, they shouldn't be doing anything with us.
No, exactly. We definitely want to make sure that we're focusing in on the most important, which is lifestyle, sleep, good nutrition and diet, and then adding TRT to that. You'll get amazing results.
Yeah, absolutely.
If you need it.
Yeah, you're going to be able to recover faster from training. You're going to be able to have more sex, better erections, Sorry, I'm going off.
You can see you got a little bit excited there.
That's just me.
I think it's important to talk about. So a lot of blokes out there will be thinking exactly this. We're all pretty much in this podcast, in this room, are a similar age where these things are quite important. And I think you are not only in a medical position, extremely well qualified, extremely experienced, you now live in it. You, off camera, we spoke about how you're now on TRT, and even then at the end of one of the statements where you probably wouldn't if you weren't exercising because the volume of training. So
Absolutely.
Walk us through experience.
Absolutely. So I noticed I started training, I had a bit of a time off of training, maybe about just a few years where I weren't training as much through COVID, and I started training properly again in April 2023. I started training at First Legion Gym, and I was around a group of males that hold themselves to the highest physical account that they can be. They're athletes, they're Thai boxers, jiu-jitsu guys, MMA fighters, and I've created a nice circle of friends there. And I'd started training there, and then I realized, okay, I'm gonna have to start getting back into some real training. So I started doing some weights, started doing some cardiovascular exercises like running again, and I started doing jiu-jitsu and Thai boxing. However, what I noticed was that my recovery wasn't as good before, say, 2019. It was really bad, and I did my testing because that's kind of what I do as a job and as a living. So I did my test, and I found out my total testosterone was I think it was 7.9. So it was actually lower than the clinical range, and my free testosterone was ridiculously low. So I did another test, and then I spoke to my own medical doctor, and I went on to TRT, and it was life-changing. It was life-changing in the fact that I could just recover, and I got much better results out of the gym, 100%. But then
I guess one of the big things for anyone watching is, you just said it, if you're just getting back to the gym, it's hard enough anyway. Never mind if you're coming from, you're fighting against the current in terms of you're trying to make your body do things that physically is going to struggle to grow. We all know a well-programmed training plan is there to literally damage the body. So
absolutely.
If you haven't got the basis of this, you're not setting yourself up for success. I think that's interesting to talk about. Yeah.
So I mean, sorry, what's the question?
It's just how the importance of echo and the importance of the fact that you are now. Most people will be trying to get into the gym with a depleted level of testosterone, thinking it's just hard, but it's just a multiplier. The thing's not going to have any longevity to what they're already doing. Okay, so
I want to go back to the point that we were just making. So I started training again properly in 2023 after a very long time off. But before I started the testosterone replacement therapy, which I've only just started this year in 2025, I gave myself a couple of years, more than a couple of years, to get myself squared away, get my lifestyle, activity levels and nutrition all squared away. But if you go back into the gym at 39 years old, if you go back into the gym at 39 years old and you try to put yourself through the same pace as what you was, say, even at 30, you're going to fail, and you'll fail miserably. So you need to have someone to help kind of guide you in the right way, where less is more, and it's called diminishing returns. So if you put more into it, you actually get less out of it. So for example, if I had a 40-year-old guy come to me and say, Calum, I want to, and I do often get this question, I want to get back to being like, as in good health. I want to increase my athleticism. I want to do all this kind of good stuff. I would tell him, don't overdo it. That's the first thing I would tell him, because overdoing it will give you them diminishing returns. So you could train 7 times a week, where three times a week would be much better for you, because you're going to recover better.
And I think exactly right. And it's all part of that, anabolic and catabolic kind of seesaw. So basically, are you, yes, testosterone is going to make you more anabolic, and the more testosterone you take is going to make you very, very anabolic. But actually, when you hit that stage of actually 30 and above, you do start to become more catabolic.
Yeah.
So you lose more bone density, you lose more muscle
mass. You definitely lose muscle mass.
Yes, you put more fat on, which is like, but in essence, you start to lose things rather than gain them. So of course you want to train to try and counteract that. But if you can't reach those levels because your body won't let you have those capabilities, TRT should allow that. But you want to make sure on that seesaw side of things,
the foundations
are solid. Yeah. You're not really pushing on this catabolic basis of poor sleep,
absolutely,
poor diet, poor lifestyle. You know,
and going back to some of the other some of the not symptoms, sorry, some of the other benefits, the good side effects of testosterone. So obviously the recovery potential is amazing. My sex drive went through the roof. I mean, it was like I was 21 again. It's not like my sex drive was one of the main issues. It wasn't, but it was all the goddamn time. It was just, it started to get frustrating, just like my wife got frustrated me asking her to have sex all the time, unfortunately. And then, so that is, I mean, you're going to be, and this is just keeping my levels between 25 and 30. It's not super physiological doses. And the drive that comes back with that is absolutely phenomenal. But I had everything else sorted. My nutrition was sorted. My body fat was sorted. My body weight was sorted. My activity levels were sorted. Everything was squared away before I started TRT.
Did you get any notable benefits when it comes to sleep?
In actual fact, some research suggests, and I can speak to this on an anecdotal base, that TRT actually does help with sleep. So it can, and even some clinical evidence, and this is where you have to be careful, is that it can, if you've got sleep apnea, it will make your sleep apnea worse because it does help you sleep better. But yeah, it can just kind of reset the clock, in my opinion. People often ask, is that, like, I don't know if anyone knows of, well, we do, Marvel, Captain America. Do we have a super serum? Yes, it's called testosterone. We absolutely have it. It's redder, but you have to have your foundation sorted before you're allowed to have it.
Agreed. So I think that brings us nicely on to negative side effects. Because this is so, and I think we're in a good space here. We're talking in this room, especially, I imagine some of the people that start to watch this should be this age. But let's talk about ages where this is appropriate, where it isn't, in your medical opinion. What are the side effects?
Before we go back on side effects, the other really good benefit to TRT for me was my ambition came through the roof again. So I've always been an ambitious person, more so than most people than I know. I can't sit still. I have to be doing something. And I did notice as the years have gone by that my ambition started to decrease. So I wasn't as, I don't know what the right way to kind of say this is, but I suppose I wasn't as willing to go out and do the things that I needed to go out and do. And since being on TRT, my ambition and my drive has just come back. My drive for work, my drive to succeed is there exactly where I was when I was 30, wanting to get out there and prove and get at it. Side effect wise, it's really interesting. So the problem is with TRT is that it can, in a certain subset of people, it can increase red blood cell production, and we can measure this through hematocrit. And if you increase red blood cell production, you're going to increase the thickness of your blood. And that's not a good thing, because the thicker your blood, the harder the heart has to work to pump out that blood. And you can actually cause damage to the heart. And many bodybuilders that do super physiological doses have damaged their heart. They have increased left ventricular hypertrophy. That means their wall in the most important part of the heart, the left ventricle, which pumps out oxygenated blood, is thicker, and it starts to decrease the amount of volume that your heart can pump out. And that's not very good. That you don't want that, because in a lot of cases that is irreversible. So once you've got to the point where you're doing, you've taken, and it takes years of super physiological doses of testosterone, that is a problem. So, and this is why we're so adamant to keep the levels below 30. So, really you're looking at between 20 and 30, optimal maybe 25 to 30. But anything over 30, you're going to increase, you've got a really good potential of increasing red blood cells, which is going to increase the thickness of your blood, which is going to, the viscosity of it. You're going to have issues pumping out more, with your heart pumping for sure. So that's one of the big side effects. I'd say that's the most common side effect. And then I'd say another one is if you start to take too much testosterone, you only have a certain amount of receptors that can respond to the testosterone. So once them receptors have gone, once them androgen receptors are done, that's it. No more testosterone can be used. So the body, the hypothalamus, which monitors the blood, goes, whoa, this is too much. Let's start getting rid of some of this testosterone. Converts it to estrogen, converts it to DHT, as we just said, and then that increases your disease risk for different types of diseases.
And estrogen, for those that haven't twigged, that's the female?
It is the female hormone, and men do need a certain amount of estrogen, especially. I think it's more for the mental health, but not too much, of course, because you just end up being a woman, and we're taking testosterone, so we're not women.
Yeah, it's a byproduct of basically we all come from the same simple
DNA
DNA profile. Yeah, so we're all going to have. Women will have a certain level of testosterone. Men will have a certain
and women need testosterone.
Exactly. So they need it.
In America, there's even in America, women are actually taking testosterone injections.
It's becoming more and more popular now than what actually HRT and bioidenticals are. Like testosterone. Everyone wants to be on testosterone.
It's a wonderful.
It'll be dogs next, won't it?
Yeah, damn right. Get the dogs on it.
Yeah.
I think the dogs have all been tested. But that's what we've been doing medical tests on. Yeah, so that's the side effect. So too much testosterone just increases your side effect profile, increases your disease risk, and doesn't do nothing for you. It does nothing more for you. The reason you see bodybuilders bigger. So say I keep I'm not going to end up massive. I'm certainly got more muscle mass than I did have, 100%. And it's a lot easier for me to lose body fat, but I'm never going to get to the size of like some of the bodybuilders or powerlifters. I'm not taking enough testosterone. And what bodybuilders do is they won't just take testosterone. They'll take androgens that are 6 times more potent, like tren, that are 6 times more potent than testosterone, and that is really bad news. I wouldn't ever advise anybody to do any of that because it's just too powerful, and it causes. So for example, these bodybuilders, they'll end up getting such big muscles, but their ligaments and their tendons don't follow through with that, so they end up getting so many injuries. It's unreal. Because their ligaments and tendons, they're not responding to the androgen that they're taking as the muscle mass is.
And I think the issue is you start to get this, like if you take too much of it as well, you get this hypogonadism. Where basically your brain stops sending signals from the pituitary to the testicles, and then what happens is those signals will just stop. Whether it's secondary or primary.
That is a risk. Even so, now I'm taking TRT. My pituitary is not. I'm not releasing LH and FSH until my testes to do anything, and you'll get some testicular shrinkage.
Yeah.
Fortunately, I've not suffered with testicular shrinkage.
Of course.
Yeah. You can check. I'm in Leicester.
This is a stigma for everyone. People say, "Oh, it makes your penis shrink." It's complete rubbish.
No, it won't make the penis shrink, but there is an issue with testicular shrinkage. Fortunately, though, you can easily. And it is easier. So you can take human HCG, which acts like human gonadotropin hormone. You can take other things like Clomid. And what they'll do is they'll rebound your hypothalamus pituitary testes axis, the HPT. So as long as you're not abusing it, that potential to reverse it. Or you can even take, I know like a lot of clinics are doing this. You can take HCG with your testosterone, so you don't ever actually lose that function.
Yeah.
So, but when it comes to super physiological doses, it's far harder to restore the HPT than it is when you're just doing regular TRT, because your body's just responding to what would be a normal level of testosterone in the body.
Yeah, you start to have a complete breakdown of that axis. Yeah. Exactly.
Yeah. And what would you class as a super physiological dose? Anything over the 30 mark?
I would say anything. Normally, it's very rare. I don't actually, out of the thousands and thousands of tests that I've done, I've never seen anyone with a higher testosterone level naturally than 32. So, I mean, we have and the clinical research shows that as well. So we actually have good, solid data of what super physiological is. And I think when you start going over 35, you're in trouble.
What's the highest score you've ever seen?
I've seen someone recently this year, at 120.
What?
Yeah.
Mine's 109.
Was it?
Yeah, yours will be on the one.
Yeah, I've seen that and above 200. I'm sure.
Yeah,
it's crazy.
What sort? Let's talk about that. I think that's an interesting one because nothing against the bodybuilding industry, but there's more and more young people, and if there's someone watching this that's mid-20s.
They should not be doing testosterone mid-20s, because in your 20s, that is peak testosterone time. It's when you're the most testosterone secreting of any of you for any age. And for you to be taking TRT at any level, even at the levels that we're talking about here, which is just a modest amount, for you to be taking TRT, it's absolutely ridiculous. You're just going to mess yourself up for a very, very long time, if not forever. It's no good. Not at that age.
Like, I think this has been around for a long time, right? You know, getting testosterone out of gym bags, taking it, trying to catch up with the Joneses in the gym, and then you're seeing people like with terrible levels and a huge amount of side effects in terms of feeling low libido, of course, but then also a number of other things as well, like terrible cholesterol profiles. And these guys might only be like, 25, 30. It's quite a scary scenario at that age.
Yeah, and I actually think when you've got a terrible cholesterol profile, adding testosterone to the mix, especially if you're going to go over the prescribed, like over the amounts that we're talking about now, you're just increasing your atherogenic risk, which is basically you're going to lay down plaque because you're making them red blood cells thicker. You're making your blood thicker through the increased production of red blood cells, and you've got all this cholesterol buzzing around the arteries as well. That's not a good mix for cardiovascular disease.
Have you guys any heard of paleotherapy? I'm not sure.
Paleotherapy.
Vitamin C, lysine, and citrus bergamot.
Is that because Linus Pauling?
It would be, wouldn't it? Yeah.
Or is that the guy that did it? I think the guy that
they didn't acknowledge him. They struck him off, I believe.
That was Linus Pauling, surely.
No,
because it was just like huge levels of vitamin C.
Yeah, so I was prescribed it many years ago just as a case study. My cholesterol was ridiculously high, 6 weeks, barely improved my cardio, which we all know is a good.
Lauren Cornney is the one that did the paleo diet, and I think he.
Is it paleo or paleotherapy?
Paleo.
Basically, it was citrus bergamot, lysine, vitamin C, 2,000, and 3,000 milligrams. Do not do 2,000 milligrams of vitamin C on an empty stomach. No,
you'll be shitting through the eye of a needle.
Yeah, it was nice. But in 6 weeks, it was a fairly natural protocol that I followed.
Yeah.
£46 for 3 months. Just on the cholesterol front, if we've got people watching this. Have you guys heard of that before?
No.
No, and I think the thing is, like you say, with the problem is with vitamin C is the absorbability of it is very tricky, taking on that much that quickly. So then people are starting to push towards intravenous therapy and things like this, and then we're again leaning into that side of super physiological dosages of what your body can handle, so it's a tricky one, but I'd like to have seen the data as you go, like has anything else changed, etc.,
And this all leads back to, so if you're thinking about TRT for this point, it's just health markers, right? It's blood testing, it's getting the foundation.
Absolutely. Why wouldn't you? If you're not assessing, you're guessing, right? It's that simple. So I think the big thing is with this is that we need to know where you are. And if you don't know these things, why would you even consider it? And in this day and age, when we've all got like watches that are tracking heart rate variability, we're all keeping a close eye on bits and pieces, and getting all of our analytics through our phone. Why wouldn't you get some good blood data where you can track regularly? And then on top of that, the worrying thing is that yes, you can get your blood data, but have you got a good set of guys and a good team and a good support network who can interpret that properly and give you some good advice? The answer is a lot of time no.
Do you know where we can find them?
GC Biosciences.
Funnily enough, yeah. I do actually.
So what we've been doing in this industry, we've been doing this since 2013, and what I've noticed since 2016 to 2018 is a lot of other companies like Medichecks, Thriver, Randox, all these other companies are coming up. And then there's other TRT clinics such as Optimail, Manual, which are the same company. They're coming up. We've been doing it since 2013. I was one of the first, I was pioneering this back in 2011 and 2012. Started the company with Rob in 2013. And what we've seen is, we're obviously not a massive company, but these other massive companies, they've come in and they've dropped the bottom line so much. The blood chemistries that they offer are cheap, but it's no different to what a GP does for you.
Exactly.
They literally do the exact same as a GP. They're just doing it slightly faster. You'll go there, you'll get your bloods done, they'll send you a report. It will have hardly any detail towards it, and then they'll give you a GP letter saying this is what you should do. Your vitamin D is a bit low, you might need a vitamin this, vitamin that. You know, we will give you everything. Over the 3 months you do the test with us, over that 3 months we will give you all your diet recommendations, all your supplement recommendations, your lifestyle interventions, such as what training you should be doing, you know, what you should be doing in general in your lifestyle. We'll give you support over 3 months, and we'll give you test data that isn't just a GP report.
Exactly. I think the big thing is with this is that, look, don't mess around with your health. Let's keep it simple. Get yourself tested, keep an eye on things, and let's call it off there. I think there's plenty of information for people. Yeah.
Sound. Yeah, I think if you're considering TRT, you should come and sort out your foundations with GC Biosciences first, and then you can go on the TRT if you need it.